Welcome to another Sono of a Week. I'm Dr. Michael Schick. It is a dark and stormy night at your emergency department, and a patient comes in who has looked better, not looking so great. Patient says, my stomach hurts, meaning they have abdominal pain. Maybe they have back pain too. So what we need is a clinician that knows how to use ultrasound to make a critical diagnosis immediately. Now what this hero did is they put the ultrasound probe in a transverse plane right on the abdomen and pushed through that bowel gas so they get a clean shot of the aorta. You want to visualize the vertebral body, which is going to be a very hyperechoic line with nice shadowing behind it, because right on top of that, on the left of the patient, is going to be a transverse aorta. You'll probably see the IVC on the right side of the patient as well, or left on this screen. Now, ideally, you want to visualize the aorta in its entirety. You're going to start in the subxiphoid region, go all the way down to the umbilicus. That's going to correspond to the proximal aorta down to the bifurcation. Keeping in mind that most aortic aneurysms are infrarenal. So you want to visualize the celiac trunk as well as the superior mesenteric artery and the bifurcation of the aorta. And then you really know you haven't missed anything. And to visualize it in both the short and long axis would be the complete way to do this. And you're really looking for a size greater than 3 centimeters. That's how we define an abdominal aortic aneurysm. And anything over 5 centimeters is often a surgical issue immediately. But the rate of change is what really matters. If it's been brewing for a long time chronically, not as dangerous as one that is rapidly expanding. And the type, whether it's saccular or fusiform, also makes a difference to our surgeons. Remember, the sensitivity and specificity of this exam done by an emergency clinician at the bedside is really great, so you can do this. In our very first clip, you can see the vertebral body here. It's a hyperechoic line with a shadow beneath it. And on top of it, we see a large aortic aneurysm. It's in the transverse plane, so the aorta looks like a circle. You can see some areas of blood flow here. This is the anechoic region where blood's actually flowing, and then there's a lot of clot also within the aorta. And just by using the centimeter hash marks on the side, we can see that this is an aneurysm that's more than 3 centimeters. If you go to the next clip, which shows the infrarenal section, you can see this transverse aneurysm is really large, way more than 3 centimeters here. See, it has a true lumen here, and then also clot within it. The vertebral body is down in this region. Now, most people will have the same reaction when they see this. But the important thing is to keep your cool, get your consultants involved, get everything you need together, because you have to act quickly to save this patient if they're actually bleeding out of this aneurysm. So thank you to our ultrasound hero of the week. We're all expecting great things from you.